Hello everyone, this is Dr. Prathyusha Chavva from team MDS CONQUER. Let's go ahead with part 6 of Neet MDS 2025 recall questions. Yeah, let's have a look at the question. A child patient, specifically they have mentioned that the patient is a child patient, right? Complaints of increased salivation, premature loss of teeth, loss of hair in patches. Something is clicking your mind. Yes, everything we have covered. Profuse salivation in a child with premature loss of teeth, loss of patchy hair loss, okay, with maculopapular rashes on the screen. Everybody must have given correct answer. The answer is mercury poisoning, right? Mercury toxicity, also called as acrodynia, or also called as Swift's disease, right? The patient appears pinkish in color. We have already covered this innumerable number of times in our smart videos and also in our bootcamp series and pro-life classes and offline classes. Same question was given in your mock exam. If you can see, the answer for this is mercurialism, or it's also called as acrodynia, Swift disease, or pink disease, right? Very easy question, scoring question. I hope this question is pretty clear to all of you. Let's go to the next one. Next question. A patient is planned for elective partial thyroidectomy. Okay, now they are saying that the patient has to undergo a thyroidectomy. Few hours after the surgery, she complains of difficulty in swallowing and aspiration into the airway. When we are dealing with the anatomy, we have dealt with all the nerves, the superior and laryngeal nerve and the recurrent laryngeal nerve and the branches. When the injury occurs in a particular branch of the nerve, what is the corresponding problem or difficulty that the patient will face, okay? So same thing they are saying, that above the level of vocal folds there is loss of sensation, okay? Which nerve is injured? Yes, clearly if you can see it, this is the pro-life video that Raj Koila ma'am had taken for anatomy, general anatomy. She is our general anatomy mentor. If you can see here, internal laryngeal nerve is the answer, correct. Same question she has very clearly explained here, right? Above the vocal cord, if there is loss of sensation, there can be aspiration, and it is because of injury to the internal laryngeal nerve, which is a branch of the superior laryngeal nerve, right? This is a very important applied anatomical aspect that we deal. All the other nerves are also explained, like when there is a damage to the recurrent laryngeal nerve, what is the motor function that is impaired, what is the sensory function that is impaired. You have hoarseness of voice, dyspnea, along with aspiration, and also what happens if the external laryngeal nerve is injured. So this is very clearly explained. No going wrong in this question as well. Very simple question, but an applied aspect was asked. So definitely the answer for this is the internal laryngeal nerve. So far so clear. Let's go to the next question. Very simple question again. Which artery passes between the roots of the auriculotemporal nerve? Okay, again this is a pro-life video snapshot that I have taken here, right? Very clearly, middle meningeal artery is explained, right? What is the diagram that ma'am has drawn here? Very clearly, she has explained that in the infratemporal fossa, between both the arches of both the branches of the auriculotemporal nerve, you have the middle meningeal artery. Very clearly explained. This is a very important anatomical landmark, and also it's involved in the extradural hematoma, and the location of it, everything is explained, right? So very easy question, again covered in our smart videos. Nothing to miss here, right? Going to the next question. After a collision with the dashboard of a car in a road traffic accident, clinical and radiographic examination revealed injury to the inferior alveolar nerve. Now, he has already told us that the patient's inferior alveolar nerve is injured. That is a branch of the fifth cranial nerve, right? which muscle is paralyzed? Okay, which muscle is paralyzed? If you look at all the muscles, if you look at just the insertion of the motor supply of these muscles, geniohyoid is by 7th, right? Silohyoid is by 7th, hyoglossus is by 12th. So the only muscle that is supplied by the inferior alveolar nerve is the mylohyoid. Same mandibular nerve and its branches, very clearly discussed in the bootcamp series video, right? These are very, very important. Nerve supply has been dealt very much in clear throughout our discussions, okay, in the discussion forums on WhatsApp, in our smart videos, in our pro-life videos, because it's a very, very important topic. From the exit from the foramen ovale, what are the anterior and the posterior divisions that are given out, and what branches, that is the nervus spinosus and the nerve to medial pterygoid, arises directly from the trunk, and from the anterior division what are the 4 branches, and from the posterior division what are the 4 branches, right? So this is mylohyoid, nerve to mylohyoid, right, is a branch of the, if you can see here, it's a branch of the posterior division of the mandibular nerve. So inferior alveolar nerve is also a branch of the mandibular nerve. So the only best option here is, because of the nerve supply, very clearly you can come to a diagnosis that mylohyoid is injured. Very, very clear. This is a pretty simple question again, based on applied anatomy. Let's go to the next question. Next question is logical based, okay. Even if you do not know the clinical anatomy of the neck in detail, if you just know the placement of structures from superficial to deep, you can answer this question. If you look at the question here, okay, they are asking superficial slash injury to neck which causes air embolism is because of injury to what structure in the neck, is the question that they are asking. The options are external jugular, common carotid, subclavian and jugular venous plexus. Common carotid is not present, okay, it's present in the medial aspect, much more medially, right, and it's much more internal. Subclavian, jugular venous can be the answers, but the most superficial one is the external jugular vein. If you look at the neck, okay, can you see the structure? Very clearly ma'am has also explained, right, which is an indication of the right atrial pressure, external jugular vein. Because it is the most superficial structure, only the investing layer of the deep fascia will be covering it. Nothing apart from that, the skin, the superficial fascia, and you have the external jugular vein. So if there is any injury, the first structure that would be affected would be the external jugular vein, and so air embolism is pretty much common in that particular structure. So the answer for this is external jugular vein. Very simple, very straightforward. Even if you do not know, yes, by using simple logic, I think all of you can come to the diagnosis, right? Let's go to a few of the questions from physiology, right here. A patient fell from the bed, okay, he fell from the bed. On examination, there was complete loss of left eye vision, okay, one eye vision is completely lost. Which structure is involved? So this, the entire, what do you say, what all defects can occur based on where the injury occurs, okay, whether it's optic nerve, optic tract, optic chiasma, whether it is hemianopia, bilateral anopia, okay, whether left half of the lateral half of the left half of the eye vision is lost. Everything has been explained very clearly. If you can see, these are handwritten notes, okay, by Dr. Shrikant. Very clearly, injury to which part causes what result has been clearly given to you in your discussion forum, right? And also we have a question, right? Patient complains of complete loss of left vision in the left eye. Okay, this was also given in Neet 2023, right? The answer for this is, yes, optic nerve. When there is complete loss of left eye vision, the answer is optic nerve, right? It is a repeat. It was also repeated in 2020, 23 and now also in 25. Right? Very commonly repeated question. Yeah. Let's go to the next one. Clinically, a patient had pallor and fatigue, more commonly going towards anemia, right? 1 second please. Yeah. Pallor and fatigue. So definitely they are saying that patient was diagnosed with iron deficiency anemia. Which defect is responsible for this condition? Okay, this is again a bootcamp series class, okay, taken on general medicine and physiology, where all the anemias were explained in detail. And this, if you can see, I have given you a very clear table differentiating iron deficiency anemia from anemia of chronic disease. And if you can see here, already I explained that transferrin is increased in iron deficiency anemia. Okay, so the answer for this is defect of what is responsible for this condition? It's a transferrin. Transferrin is nothing but the primary iron transport, okay, in the body. If you look at the first two options, ferritin and hemocytin are storage forms of iron. Okay, they are storage forms of iron. And transthyretin has nothing to do with iron. Okay, it is thyroid related. Thyroxine binding, it helps in thyroxine binding. So the answer for this is transferrin. Okay, very, very clear. Next, let's go to the next one. Okay, this was a little bit tough, I feel, from all the questions given in physiology. Uromodulin is secreted from which part of the nephron? Now, in the smart videos that we have taken on physiology, right, by Dr. Saiti, we've already covered the excretion of urine in complete detail, starting from the glomerulus till the collecting tubules, which part is permeable to what ions, which part has the maximum absorption of what all molecules and what all ions. And in that, ma'am was talking about thick ascending loop, okay, the thick ascending loop of Henle, okay, where the answer for this is thick ascending loop, where uromodulin is secreted. Now, uromodulin is the most abundant protein in human urine, okay, in human urine, and it is protective. How is it protective? Okay, it prevents the stone formation, prevents the calculi or the stone formation, and also infection. Okay, so the predisposition to infection and also the stone formation is prevented by uromodulin, okay, and that is secreted in thick ascending loop of Henle. Okay, so the answer for this is C. Yes, going to a few questions from the general medicine. Patient comes with a stab injury to the chest. Now they are giving us 3 symptoms. Patient has 3 signs, in fact. Patient has hypotension, distended neck veins, and muffled heart sound. If does it along with pulses, paradoxes. Okay, all these come under Beck's triad. Okay, I hope it is ringing a bell. It was covered again in smart videos very clearly. Okay, cardiac tamponade, right? Beck's triad of cardiac tamponade. What should be the immediate next step? Everything has been covered in detail, starting from the etiology, history, examination, where you can see tachycardia with hypotension, pulses, paradoxes, okay, distension of the jugular veins, right? The answer for this is pericardiocentesis, okay, pericardiocentesis. Even the treatment aspect has been explained. Needle decompression, chest tube insertion are done in pneumothorax, okay, pneumothorax, and IV fluids are not indicated in cardiac tamponade, okay, very clearly explained. Let's go to the next one. A patient complains of excessive cough production, okay, especially in the mornings. The cough changes along with the posture. Crepitus is heard on auscultation and clubbing is seen. Now, this one positive aspect you have got, right? Now, among the given options, which is the only option that has clubbing? Yes, it is bronchectasis, okay. What is the most probable cause? Same thing we have given in our mock exam also. Pleural and sputum, cough and clubbing of fingers is probably suffering from bronchectasis, okay. The others do not have clubbing, so clearly you can eliminate even if you do not know. From the symptoms that the patient is having bronchectasis. If you know just what all, where all clubbing is present, the respiratory as well as the cardiac conditions, you can automatically come to the diagnosis that is bronchectasis. That was the end of part 6, right? This is our contact number. For any details, any inquiries, you can always feel free to call this number. We are there, a phone call away. Thank you so much. We'll meet you in the next part.